Okay.
Alright, so I'm going to do a colostomy change today. I'm going to follow my TAR, which has my patient, his name, his age, gender, but I'm more so looking for his identification, which will be his date of birth, his last name, any allergies, so if I have any supplies that will cause a reaction. And then I want to make sure I have his physician if there's something that's abnormal on my assessments or if there's a question. And I also want to make sure that I have the right time if there is an actual schedule for his colostomy care. And it says that he just gets a regular care, PRN. So I'm going to go check on him and make sure he's all set and do that. So I'm going to wash my hands before I enter the patient's room.
Alrighty. So, wash my hands obviously.
I'm going to knock on his door.
So we're going
I'm
straight
going to come
to the
in.
hole. Assessing.
Hello, Mr.
I'm gonna
Anton.
assess both feet
My name is
bilaterally.
Melissa. I'm your student nurse today. How are you?
Level.
Good. Can I just ask you to verify who you are? I'm going to use two identifiers.
Very good. Awesome. Move
Can you just spell your last name for me?
Sensation.
Okay. And what's your first name? Perfect. And your date of birth?
Once you're done identifying
So
the
this is
patient,
who-
you should
Thank
also
you.
provide privacy
I'm going to
before
do
you
your colostomy care
converse
today.
about his medical care.
Have you had that done yet? Okay, you have. Have you performed the procedure yourself? No? Okay, so I'm going to help walk you through that. Do you have any pain? No? That's really good. So, I'm going to grab my supplies, and I'm going to come back in, and we're going to do your care. Put it back where you need. I prepared my supplies in advance, so I'm going to pull these into the room. I have a trash barrel, which is also prepared, and I have a linen basket, which is right next to my trash can. So, I prepared my supplies in order of how I'm going to use them. So I'm all set up. Because I left the room to get the supplies, I'm going to rewash my hands. I'm going to put on a clean pair of gloves. We put the pair of clean gloves on before we start touching the linens because we don't know if he had any leakage from the ostomy or if there's anything else going on with this patient. So, put the gloves on. Then I'm going to raise the bed to a working level height to make it more comfortable for myself. I'm also going to make sure that the curtain is fully drawn so there's privacy. So now I'm going to go through the procedure with you. So I'm going to roll back the covers. I'm going to try and keep as much skin covered as I can for his own privacy and dignity. So his colostomy is empty, so I can see that. I'm assessing the skin. There doesn't seem to be rashes or bumps or any skin integrity issues that I can see of, which is good. So I'm going to then listen and oscillate for any bowel sounds. So I would take an alcohol prep, and I would clean my stethoscope. I'm then going to listen in all four quadrants. If you don't hear anything, you're going to wait 5 minutes for each quadrant, which should equal 20 minutes total if you don't hear any sounds. I am hearing sounds, so that's good. We'll check the last quadrant. Okay. So I do hear ostomy sounds, which is good. I'm going to quickly wipe down my stethoscope again with alcohol. I'm going to fold it up and put it away.
Yeah, I think last week
I'm going to then palpate your stomach, okay? Can you tell me if there's any tenderness or pain?
He asked me to,
You're going to feel for any bulges or any rebound pain, just when you come back up and then he feels the tension. Okay. So nothing? Alright. So I'm then going to remove the colostomy bag. After,
Make sure not to touch your gloves to your face after they've been put on.
towels for care. Now his is empty, but just in case, if it was full, if you want to put a blanket, well, a towel, bath blanket, down here. You also want to cover up his abdomen where you can, over on this side,
So I'm going to take it off.
because we don't know where it's going to possibly leak.
Check, look for drainage. There's no drainage.
It's a little more comfortable. So, I'm then going to remove the colostomy bag. I'm going to throw it in the
I'm going to
garbage.
assess it all after I clean it. So.
And I'm going to take my gloves off with it.
granulation tissue, all that stuff. But, you know, wash my hands
I just have to
obviously.
split this whole. I'm going to
I don't
re-sanitize
measure
my
the depth
hands.
because it's stage 2, superficial. So they told me at least, so. Alright.
and put on a new clean pair of gloves.
And of course, I already asked him about the pain. How are you feeling? Really had
How are you
enough
feeling
today?
so far?
Okay. Now I assess. I don't know, you know, obviously any drainage. So I'm not gonna touch, I kept like reaching over last time I was doing this. Only with one hand, right? For like tenderness.
So as a point,
So,
it is.
I have a washcloth ready with warm water to clean the area.
So now.
So I'm going to take it out,
Right.
and I'm going
And when not nervous by a camera, remember how to fold your washcloth appropriately to clean the area.
wash the area. So I'm going to
So I'm gonna grab this. Next to the end. I'm gonna squeeze it
and then I'm going to put it in here. That'll go in the laundry basket when I'm done.
This one.
So the area is clean, but I gotta pat it dry. So I'm gonna take the next cloth. I'm just gonna pat it dry around the stoma,
From here is okay?
Yeah.
Okay, so
and this I'm just gonna throw in the laundry basket.
it should be
So,
through here, right? I don't know why.
Everything looks nice and clean. It's not red. I'm gonna take my gloves off before I put on the new clean Colostomy. The stoma is nice and pink, so the circulation wasn't cut off. There doesn't appear to be any infection or concern of any at the moment.
Oh, I could put my, that in there with the gloves, right? Yeah.
So now, when you're touching to the side.
I'm gonna measure it. But don't have it taken the gloves before I measure, or does it really matter?
What do you, it depends what you're currently doing. Do you want to take
I have this in here.
Oh, okay.
So, I'm then going to measure the stoma. We have a little guide here. So I want to get as close to the stoma as possible without actually putting pressure on the stoma, which can cut off the circulation. So, I touch this one. This one's 1 3/4. It's a little large.
Right, and then that's.
So next step down will be 1 1/2.
This is
And that one seems to be really good. It's nice and close, but it's not too close.
This has been a non.
I'm then going to do a skin prep. This just prepares the skin to allow the adhesive not to irritate the skin as much from the ostomy bag itself. So I'm going to put that on. Next I'm going to take my scissors, I'm going to alcohol swab them, make sure they're nice, clean, and sterile. Then the alcohol swab goes in the trash. Next I'm going to grab the ostomy bag. We said 1 1/2. So I'm going to take off this cover. These ones are prepared for us already with the measurements. I just need to cut.
Normally not touch it though,
So,
when you're measuring, so you kind of make it
I'm going to
close
push this out a
enough.
little
This
bit.
is sterile, so it's okay.
Make sure I don't cut it, 'cause I had bad luck with that.
So it's when you're doing
I'm
it
going
here, I
to
don't want
go right around the 1 1/2 mark.
This was just touching the skin, so that's okay. And the same thing, don't touch it. Here, and just do it close as you can.
Now, you don't want to prepare cut the bag because the care for the ostomy will change as time goes. So you want to make sure that you measure it for each change and not assume.
So then I
So I'm going to quickly just check.
and
see my work. Now, my cut seems a little tight, so I'm just going to widen it up a little bit more because I didn't cut it fully to the 1 1/2 line, it seems. So we're going to cut it a little wider.
And then, you know, once I get all my assessments,
And as of this point, this hand's only been on sterile. So it's okay as long as you're not putting this hand touching this, so as long as you're.
It took off a little more.
right. So I'm doing all my
Check
assessments
again.
with the working hand. Once I get all that, there's no swelling.
And that's a much better fit. So I'm going to take my gloves. Not my gloves, my scissors. I'm going to alcohol swab them again. I'm going to put them down. I'm going to take the ostomy bag. And I'm just going to then remove the adhesive stick.
Well, I already patted it dry too.
And I'm going to move the secondary strips here.
And even the wound nurse who was at Hair Child, she was getting a bunch of stuff.
Now these are really sticky, so just be careful. And do you usually sit up and watch TV and go for walks? Okay, so I'm going to put it at an angle so the ostomy bag kind of works with gravity for when he gets up out of bed today. So I'm going to press it down and hold it. Make sure that it seals nicely. If it's not a complete seal, you're going to have leakage, which will compromise the skin integrity. So next I'm going to grab a clip. Now, not to irritate the skin with the folds from the plastic, you're going to take it and fold it up towards the ostomy with a thin strip up.
Doing that, being all comfortable with it, being all that's my hardest part too.
And you're going to clip it nice and tightly and secure. Make sure it's in there, because otherwise you're going to have leakage this way as well. So, now the clean bag is on. I'm going to remove the towels.
I get a lot more with this.
I'm going to put them in the laundry basket.
Person talking to me saying what I'm doing wrong. Because like I watch the model, it's not how they do it right.
I'm going to
I don't know how I do it.
provide the patient with dignity.
Right.
I'm going to roll up the covers.
Okay, so then I cleaned it obviously. So
I'm going to take off my gloves.
I already have a tape.
I'm going to rewash my hands. And then I'm going to make sure with the patient that you're comfortable and you understand everything. Do you have any concerns or any discomfort from that? No? Alright, so I'm going to go clean up my supplies. I'm going to go document, and I'm going to come back and check on you in about 30 or 40 minutes to make sure that everything is still okay and you're not having any issues. Okay, so I'm going to lower the bed, right on the call bell, and I'm going to go document and clean up the supplies as I stated.